Hello and welcome back to Repod, the University of Salford's research podcast, where today we have not one, not two, but three of our researchers here to talk about their research impact. So hello, Paula, Alison and Cristina.
Hello there.
It's great to see you all here. And yeah, this is part of a series of videos and podcasts that we have about our research impact, coinciding with the release of the Research Excellence Framework results, of which lots of people are very happy. And it's a wonderful dive into the process behind their creation. And it's been incredible so far, talking to many of our researchers, hearing how the journey of a case study is not a couple of years, it's often a decade, and for many people, a lifetime sort of pursuit, really. And it's perhaps a nice place to start with that and to get into the history of this. So coming to you, Paula, just give us a sense of the origin of your research at the university. How long have you been with us, and what have you been doing over that period?
Okay, I've been with the university for about 20 odd years. I came from practice as a clinician. I was a nurse in kidney dialysis, so that's my specialist field. So I came in to do a multi-professional research fellows post, looking at developing multi-professional practice, where me and Alison started to work together in the healthcare practice research unit, which was evolved at that point in the university. And then I've worked as a senior research fellow throughout the years, developing research. So most of the research that I've done is about health information needs and the needs of patients and what information they need and patient experience. So a lot, my research background is understanding how people have information needs and then being able to deliver that information in a different way. And some of the work we're talking about today is about using digital and social media to meet those information needs of patients. So that's really my background. Alison, do you want to?
Yeah, I can give you my background as well. So, yeah, as Paula said, I've also been working at the university for well over 20 years. I came in here on the same project, but my professional background is a library and information scientist. I'd already been working in health information, so I was brought in to support the project, to provide information to the project, and was very much encouraged, as Paula was, by our principal investigator at the time, who was really supportive of people getting involved in research and really encouraged us to research our own practice. So that's kind of where I started getting involved in doing research rather than supporting research. So from there on in, most of my research was looking at information and how information and research information can be used as part of healthcare and now social care as well. And,
I mean, that's already so fascinating to hear about both of your journeys and the fact that you sort of came together around a common project. I think for many people I've spoken to, actually, the journey into research is a very up and down one. It's not a straightforward process. So it's really interesting to hear those stories. Cristina, tell us a bit about your background. How did you come to be involved with the case study, but also research at Salford more generally?
Thank you, and thank you for organizing this. Before I'll go on to say about my background, I would like to say that it's a real privilege for me to be around my PhD supervisors, Alison and Paula, who then became colleagues and really good friends. So going back to my own journey, I've joined the university in 2006 as an international student on a business IT course from business school. And then in 2009, I've started working as an associate on a knowledge transfer partnership project with Professor Ormandy and Professor Ben Light. And it was during that project that I've realized there is a lot more we can do in terms of digital in the healthcare context, especially me coming from a very business and digital background. And I think that inspired me to stay on and continue to do research. During that period as well, I've realized that it was through that work that I've actually realized there is a lot more we can do in terms of patient engagement. I noticed there are a lot of e-health systems developed, but then the major challenge with those systems is actually patient engaging with them. It's almost like ghost town. We have the town, but if we don't have the population, then it becomes a problem. So equally. And that really triggered my interest around patient engagement, which I've taken forward through my PhD work. And as part of that, we've set up the Kidney Information Network, which back in the days was GMKIN, the Greater Manchester Kidney Information Network. That's how everything started. In terms of my research in general, it spans across 3 different domains. One is the digital engagement, which I've kind of mentioned about. And then another domain is digital methods, which really is work, and I'm working with Professor Ben Light on that, is identifying and creating digital tools to allow us to scrape data from social media networks, analyze it, and then understanding the needs, like Paula mentioned, for example, patient information needs. And finally, through my work with KIN and involvement in other projects, I've realized that there is a lot more we have to do in terms of educating professionals and equipping them with the digital capabilities required to do well in this digital economy. And as part of that, I've progressed some work around digital education, which is establishing the digital skills passport to equip our students, the future healthcare force and the current workforce in the NHS with the skills required to do well and to drive digital innovation.
I'd like to sort of pick up on that because Paula, coming to you again, I think it must be such a different world from where you began as a nurse in terms of information systems and again, of course, digital and social media. I mean, the practice of being in healthcare must be so very different today compared to back then.
I think there are much better opportunities for people to gather information for when they need it. Mm-hmm. Not an opportunity of them going to a clinic and being given information that other people think they need. And that was a lot of the basis of a lot of the research that I've done, is that if you give people information at a time when they're not ready for it, they're not even listening. So I think it's important now that there are opportunities for people to go out and find that information and gain the information that they need that helps them move forward and self-manage. One of the key things in the NHS now is self-management, ensuring people are equipped with the skills to manage their own care and manage their own understanding of their own condition. And I think there is ways that we can provide that information or access to information to help them to look after themselves better. And I think the same with some of the research that me and Alison have done from the beginning was about providing health professionals with the information that they needed to be able to deliver the care. So relevant evidence-based information and where to find it and how to seek it. That's something we've done. So yeah, I think it's changed phenomenally, and I think but for the better for me. And whilst I'm not a massive social media whiz, which is why we've got a group together of people who know better than me, I can see the opportunities and how we would really move it forward.
Well, certainly, Alison, the ways in which information systems have been transformed over this period in society at large, and of course within healthcare, have been absolutely dramatic. And I think certainly lots of people are very enthusiastic about that potential for empowerment, for more agency. What have been some of the challenges in being able to sort of, I guess, funnel that information into a useful way for both sort of patients and clinicians, would you say?
Yeah, I think that is definitely the challenge. It's how we do that. There's so much information out there. Clinicians in particular are really time poor, so they want the relevant information, the best information there on their fingertips, if you like. So one of the ways that we've been looking at is kind of using library and information professionals to provide that information for them in a digested form. So, or train the health professionals themselves. You can do it either way, but they need the information quick, and they need the relevant information quickly. So that's where some of the works come in as well. That was one of the things that was brought into the Face Mums project, that the midwives had access to the information, but that was curated for them, so that it was evidence information that was being provided directly to the patients.
I mean, let's pick up on that for a moment, because the sort of focus of the impact case study that was submitted was around the Face Mums, which was a service set up for pregnant women, and then the network of people who suffer from chronic kidney disease. So picking up on the Face Mums, tell us what sort of platform it is and what was its sort of origin. Maybe Alison, if you can just pick up on that to follow up.
Yeah, sure. Well, the platform, you may be able to guess from the name, the platform's Facebook. It was a series of secret groups on Facebook. So if you search on Facebook now, you wouldn't be able to find the groups that happened. You'd be able to find a general Face Mums page, but you wouldn't be able to find the interactions that actually happened. So secret groups were set up between professional midwives and pregnant women, and the groups endured for the length of the pregnancy. And the women were being provided with information about their pregnancy and health and pregnancy related topics throughout their pregnancy and their early postnatal care up to 6 weeks after that.
So were these the midwives of the pregnant women? They were sort of matched together?
They were well, within the same trust. So the way that midwifery care is organised. So yes. So if you were having a baby at a particular hospital, then the midwives within that particular hospital were providing that service. Yes. So there was information and support provided 24 hours. It became something like it became an online community of practice where people shared information with each other. So it wasn't just midwives providing information, the women started to provide information and support as well. So it became a really nice supportive environment. And going back to that original point about, quality of information. So initially the midwives were putting out high quality information. If the women contributed information as well, it became verified by the midwives as well. So that was one of the advantages, that it was kind of really safe, secure information and high quality information that was provided.
That's really fascinating. And Paula, I wonder, because immediately I think to myself, if you are a midwife, then the prospect of having to engage on a social media platform with your patients, perhaps outside of your working hours, how did it sort of fit into the lives of the professionals? Because otherwise was it sort of demarcated as sessions with the patients, or was it just sort of quite informal and they would go on to it from time to time when they found it possible?
I think from a clinician perspective, and Alison can probably answer this better than me, but it was part of their role. They were there to do they were there to deliver that care in that way. Alison, you were closer to it, so.
Yeah, as Paula says, it was part of their role that they were paid to do that. They developed ways of working, so there was. It would be checked outside hours, but often midwives are on shift outside you know, they don't work 9 till 5. So,
Yes.
so often they would check. I think I'm pretty sure that some of the midwives did check outside their shift hours as well. And sometimes there would be a delay in responding, but that was often when the women would step in and go, actually, do you know what, I can answer on something like this. Often 2-3 o'clock in the morning, when we analysed when there was a lot of activity, 2-3 o'clock in the morning when women were awake or when they were feeding their babies after care, there was lots of activity going on.
But that was more of an opportunity for them to speak to other people, and you know, other women, and that's the fantastic thing about this these impact case studies, both kin and face mums, is it provided people with an opportunity to speak to other people in the same position with the same type of symptoms undergoing treatment locally, in the same place, so they had a commonality from the outset. And then they would talk about and share their experiences. And by sharing their experiences, they were actually learning different strategies on how to manage things differently. And, you know, there's evidence throughout the case study of how that positively influenced care, how women cared for themselves during pregnancy, and also how kidney patients manage their symptoms, their condition, their depression, their anxiety, how they managed just even measuring themselves against someone else and thinking, actually, I thought that was just me.
Yes.
So I think that was really what came out, and really strong, that people felt that they weren't on their own, and it wasn't just them feeling like this. There was actually lots of people who felt the same, and here's a way that they overcame some of that. And so people would try some of those strategies, which were really useful. So
yeah, it's really fascinating to hear, because it sounds like a real community was established. And Cristina, I know that your sort of work on digital health more broadly sort of investigates ways in which we can think about those platforms possibly as communities. So tell us a bit about the sort of theoretical models and how you sort of develop a system that works. How do you make this effective rather than just another place that people sort of linger?
Oh, it was a journey, especially because when I started this work, and I recall sitting in Paula's office, and she started to share with me about PD, HD, all linked to chronic kidney disease, and which I've had no experience, and I couldn't even understand the meaning. It was like yet another foreign language for me to learn. But then what I always consider is we have to think what can bring people together. And although initially, when we've developed the Kidney Information Network, we thought that by having a system or a website that could actually act as a central point of engagement, through which then we bring patients in, and then from the website we could navigate to other channels that we have created. For example, an online community on Facebook. So we've used Facebook as well. And then we explored forums and Twitter, because I was also interested in how the role of each platform plays within this engagement. However, the more I've started to bring the community together as a moderator, I've realized that actually the point of engagement is not the website, but Facebook. And looking at the theory behind and the model that I've used around engagement or social capital, because we all know that communities with a high level of positive social capital, they perform better. So then that was something which I thought I would like to test to see whether it translates in the online work that we do. And it did. And the evaluation of kin kind of validated that. So what we identified were that the key aspects of engagement were information, and this links with what Alison said about the high quality of information shared within these networks, but also the lived experiences, how people lived with the condition and how they've managed chronic kidney disease on a day-to-day basis. It was also about the bonds, the relationship, the trust that patients developed amongst themselves, and the social element of being social capital, the social ties played an important role within the model. And Paula indicated that kind of hinted around the local aspect, which for the network played an important role, because patients were referring to the same services and often the same model of care. What we've also identified is that actually people engage with the community on different levels, and there's the kind of the high level or the most intensive level, which was the influencers. And the influencers were those who aim to make GMKIN work and actively engage with the network. And then the second level of engagement was the conversationalist who started to create conversation. So if someone would post, or the influencer will post information, then those who engage as conversationalists, they stepped in to comment, to like, and keep the conversations going. And then the third level was that would primarily include those who browsed the network, mostly reading information and collecting information useful to them. I think going back to that social aspect, which I've mentioned a few times, it might be interesting to share a story. So I've mentioned before that I didn't know much about chronic kidney disease, but I was moderating the network. I was there trying to make patients talk to each other and share their experiences. So the network was, the community was quiet for more than a week. I was getting hints from others saying that, oh, I don't think it's working. What can we do? And then it was a nice Saturday. I used to grow tomatoes back in the days. I no longer have time. So what I've done, I've actually took a picture of my tomatoes, and I knew so much that tomatoes, and Paula can explain more about this, are high potassium, which kind of links with chronic kidney disease. So I posted a picture on the network, and in a matter of 30 minutes, we've had conversations ranging from, Cristina, can we smoke them? to diet, and in general, how people manage on the day-to-day basis. And interestingly, when I've had the interviews at 6 months with patients, they all referred back, the majority referred back to that moment as the defining moment in the community, because what they felt was that underneath it all, we are all humans. We share a condition. You are a researcher in the community, but we are all humans. You know, we all share social ties. So I thought, and I think that stayed with us, and that's something we carried forward throughout the other work that we've done.
It's really fascinating to hear that, because I think those are often surprising moments in the course of a research project where something that you didn't think too much about had such a great impact on the journey. And Paula, sort of coming to you, I think for a moment, there's so many wonderful comments about the value of this research that's taken place, and I wonder how you sort of see it going forward. I mean, in terms of the sort of services themselves and the platforms and the communities there, obviously a lot of these things are reliant on people having access to and utilizing the platforms. Tell us a bit about where the research is presently. Is this ongoing work? Is this stuff that's developing still, or is it reaching end point?
Okay, so the KIN network is prolific through the Northwest. And I need to say from the outset, that's down to the fantastic moderators that we have that see that through. So we've trained patients to lead those networks. We don't lead them anymore. They're led by patients, and the conversations are led by patients. So it's prolific through the Northwest. The kidney community want to spread it nationally into different regions. So that's our plan, is to develop KINs in different regions and take that forward into a larger funded bid to examine self-management and the impact that it has on a bigger scale. So that's where that is. But we've also used the model in bereaved organ donors, families of bereaved organ donors who've donated the organs of their families. We've tried it out with PhD students examining whether that makes a difference using the model in that area. We've used it as a model in the kidney the Kidney Patient Involvement Network, which is a national group that I've set up. So we use it that way to talk with people who are involved as kidney patients in research, quality improvement, different aspects, and we are taking it forward that way. Alison, is there lots of other?
I was going to say there's no end to the kind of opportunities. I think when you put health information together with different social media or digital, so where the face mums kind of has gone, if you like. So it was really, I think one of the things we haven't touched on, both of these models were really helpful during the COVID pandemic. Obviously face-to-face services were closed down. Using the maternity services, there was no face-to-face antenatal care, so we were able to really expand it and provide antenatal care online, as kidney patients were able to provide support for each other as well. So that's kind of one, post case study, but quite a recent example. What's happened in relation to the face mums? We're currently piloting it with midwifery students as part of their midwifery degrees, as a way of providing digital placements, and we're using that there. So the way nursing and midwifery education happens is students, they go into practice and they're supervised in practice. We've kind of taken the face mums model, and they're doing practice and supervision of pregnant women within Facebook in a face mums model. So that's one way it's going. We've also started to look at other ways we can use these models for continuing professional development for other health professionals. We've got one going for mammographers at the moment that Cristina is also working on. So there's lots of opportunities for that. And we're kind of expanding into other areas of long-term conditions. So part of us are wandering off the social media. We've got projects looking at other long-term conditions in neurology, using apps and patient-facing digital platforms, but again, using these same techniques and these about engagement, really. How can we engage them to self-manage their own health? So there's kind of endless opportunities, I think, and we're just starting on that journey.
It sounds absolutely incredible. Cristina, I wonder, when you think about the sort of future of social media, obviously we know that Facebook is an incredibly well-used platform still, but have you done any sort of reflections on what sort of platforms might also be utilized and where you might access people differently? Because I think that Facebook does provide those opportunities to have a secure and safe environment in which people can dialogue. But what are some of the things that you're seeing that might be interesting to explore?
That's a very interesting question, Andy, and I remember being asked that question when I interviewed for the KTP project. Facebook is still around. Yes, we have seen other platforms as well, and I've tested other platforms, and I think for me, especially in my work with people with long-term conditions, Facebook worked really well because of ease of access. Dual purpose. I can use it for keeping an eye on my health, but also keeping in touch with family, which really contributes towards that engagement. What I'm very interesting, I became more interested now, more lately, is about the immersive tech, and I've seen some of your work as well. And I think that there would be opportunities to connect that way and see what else we can do. It's interesting because I've in a recent podcast, I've heard the sentence that healthcare is very high tech, in the sense that we have some incredible high-end procedures like the kidney transplant, for example, but very low digital. In that patients have no ways to communicate with fellow patients, or they find it difficult to actually see healthcare professionals, apart from the clinical appointments. Yes. They have no access to healthcare data, and I think our work really speaks to that. We try to create opportunities for patients to talk to each other. We've developed the tools to then make sense of the data they generate in order to then hopefully influence service provision, but also meet their information needs.
Yeah.
And I think, and we've demonstrated through Keen, and Alison can say more about face mums. I think disrupt around the level of care and create that continuity, especially for people with a long-term condition, create that continuity of care.
Yeah, I mean, I think it's really interesting to hear that. I think one of the questions I have also, and we unfortunately we're running out of time, but perhaps first to you, Paula. I mean, I'm hearing very much that the utilization of an existing platform that's already a part of people's lives is a really effective way to engage people in a useful setting, as opposed to developing a different environment. And I wonder, what's your sense of it, Paula? Is it, because we often sort of think about, do we try to access an existing platform or build a new service on something else? What's your sense of it? Do you think access something that exists or build something new?
I think we need to stay up to date. I think we need to move with the times. If there's something better out there, we need to move over. I think when we first started out, Facebook wasn't really, I mean, COVID's really helped actually using digital Facebook, using Facebook better. But when we first started out, some of the patients that we actually trained them on iPads to use Facebook to get engaged with the system. So people who were elderly and isolated, we gave out a number of iPads so they could join the network and see whether it improved. And they weren't for giving them back, and we actually didn't take them back off them. But so I think there's ways that we can train people to use other networks if that is a better way of doing it. So I wouldn't want us to stick with Facebook and then become outdated. So I think we've just got to move with the times, and we'll be open to doing things in different ways.
That's really interesting. Sorry, Cristina, go ahead.
Sorry, Andy. I think for me really is finding people where they are. So if we target young people, then we know there are other platforms out there. If we want to do more work with health professionals, clinicians, probably Twitter is the platform to go to. So it's really important that we have to consider the different audiences and how best to engage them.
Absolutely. And just a final word perhaps from you, Alison, about that. I think working in sort of library and information services, mindful of the challenge of connecting with people with information. And that reminds me of a project I was involved with a few years ago with the Scottish Government, where the focus was to try to get the people that remain offline into an online environment. And Paula, you mentioning that people needed training on Facebook is, I think, indicative of the fact that not everybody is digitally native. And that's a real challenge, Alison, isn't it?
It's a huge challenge, and I think that's something that we face. It's certainly the project that I'm working on at the moment, that in relation to neurology, and it's an app. We're not using Facebook. That has been one of the massive challenges, and it's how you get to those people. I think there's also culture changes that needs to go on. I totally agree with both Cristina and Paula that we need to go where the people are, and we've tried various things. We've also got a project that's international, training nurses in leadership, and they're all using completely different projects. Take things into a different country or a low middle income country where the bandwidth's different, the data setup's different, that whole different ball game. But actually back to patients, what we need to do is they need to understand why it's important for them to engage with the information and why it's important for them to self-manage. And we don't even know who those people are necessarily. So there's a whole piece of work to do to get people even to the point of engagement, I think. We've not cracked that one yet, but I think that's a challenge going forward that we need to look at alongside what systems and platforms we use. But it definitely needs to work for them.
Yeah, well, you certainly seem to be well on the way, and it's a wonderful case study and a fantastic way to make a contribution through research. So thank you, all three of you, for joining me for this podcast episode. I look forward to seeing where the research goes in the future.
Thanks, Andy.
Thank you.
Bye-bye.
Bye.